Welcome to Veterinary Vertex. I'm Editor-in-Chief Lisa Fortier, and I'm joined by Associate Editor Sarah Wright. Today we have Vanna and Danielle joining us, and Danielle's hot out of the surgery suite, so thank you both for taking time out to join us here today.
Thank you
for having us.
Let's dive right in. So our listeners are familiar already with peri-incisional liposomal bupivacaine, or NOCITA, who talked about before on the podcast. So we're really excited to have you guys here and offer your perspective and share findings from your study. So Vanna, your JAVMA article discusses how the use of peri-incisional liposomal bupivacaine was not different than placebo regarding pain score or rescue analgesia in a randomized clinical trial of 83 dogs. Please share with our listeners the background on this article.
Yeah, absolutely. So I exclusively do soft tissue surgery. So, we end up with the patients that either maybe we're doing GI surgery on or they're not as stable. So I think anytime there might be an option that we won't have to worry about as many side effects with, that's going to provide analgesia, we're super interested in it. So because of that, liposomal bupivacaine was definitely something we were excited about, and we're using it a lot. But when we started kind of thinking about the plan for this study, it was around 2020. So really the only studies at the time were in stifle surgery. So that was kind of what made us decide to do this study, was wanting a little bit more objective data on if we're going to use it in different scenarios, like our soft tissue surgeries, is it actually being as impactful as we think, especially because it's definitely not cheap.
Yeah, it's a really good point to bring up. I know that's a big point when I've even talked about it before, like with surgical planning and like anesthesia plans as well. Like, do we use it or not? And cost is a big factor, especially when it comes to like certain clientele and such.
Yeah.
So what are the important take-home messages from this JAVMA article, Danielle?
Yeah, I think the biggest thing for us was that we found that the peri-incisional liposomal bupivacaine wasn't significantly different from just a placebo of saline for the dogs that needed rescue analgesia. And what that means is an opioid injection after surgery, and that wasn't different for any time point after. So for us, what we were using was the Glasgow composite pain scale, and that is something that the technicians were trained on. But different ICU technicians were doing the pain scoring. So we kind of wanted to make it as realistic for how we would be evaluating these pets after surgery and when we would assess, do they need a pain medication or not? So, we were very commonly doing this, like Dr. Dickerson said, with the giving the injections of NOCITA postoperatively for soft tissue surgeries. So we always want to know, are we doing something that's helping in any way or hurting in any way, especially with the cost of NOCITA at our institution being, for like a 25 kilogram dog, it was about $177 for their dose of liposomal bupivacaine, and that's compared to 0.5% bupivacaine, which is about $370 for the equivalent dose. So just kind of always looking at the cost benefit for everything that we're doing.
$370 meaning $3.70.
Yes. So yeah, a lot less.
Yeah, it's oftentimes, everybody wants the best analgesia for their animals. So we just keep adding more and more and more things, and doing something that's not effective is not, it's not considered safe if it's not effective, right? Things can go wrong with injections. But I'm interested, Vanna, you and Danielle and myself are all surgeons, and oftentimes the research in analgesia falls over towards the anesthesia analgesia service. What sparked your research interest in this topic?
Yeah. Like you said, I think as a surgeon, I hope we're all very interested in our pain, pain of our patients. And so, I guess for me, it really was, the classic, like the septic abdomen that you've had to do an intestinal resection anastomosis. You really don't want to give them an NSAID. And I feel like there are more options becoming available to us, things like, Tylenol 3 that we used to not use as often, or even pregabalin, but really our options are more limited. So that's kind of why I really wanted to look at this. And it also was something, in my training, we didn't use it very often, but we were using it way, way more when I came to Texas A&M as faculty. So that was also part of what, sparked my interest, is just kind of seeing, hey, could we be doing better or not? So
yeah, very good. Danielle, earlier, Sarah asked you what maybe were the most important findings, but always when we do studies, we find something we didn't expect. What were some or one or two surprising findings from your article?
Yeah, I think the biggest thing was that we were using this a lot. We found that it wasn't significantly different, so we've gotten away from using it and just going back to that kind of evidence-based medicine approach. But I think looking into this both on the human side and anesthesia and some other studies, I think the relevance for the general practitioner would be, there are studies out there like the Wheeler paper that looked at liposomal bupivacaine compared to the 0.5% bupivacaine in spays. And they were using the just regular bupivacaine as a splash block. And that study did note that there was those dogs did need significantly less rescue analgesia after getting the actual infusion of the liposomal bupivacaine. And at our institution, we're very commonly using multimodal analgesia and local blocks, and that standard approach wasn't changed for the study. We wanted to do it how we normally would. So I think that just kind of goes to show that there may still be, in general practice, some uses for this. I think the other caveat to that is we're using a multi-dose vial for the liposomal bupivacaine, so being able to handle that sterilely. We do that in a hood, things like that. So along with the cost of just administering the injection and the injection to the owner, or the cost to the owner, that we're looking at, are we able to safely multi-dose this drug out in practice?
Yeah, that's a great point. I'm curious from both of you, oftentimes when we do studies or we read studies that prove that something we do routinely, walking horses for colic or whatever it is, that they don't work. And it's hard to even convince your own institution that the data is real. Have you had a struggle convincing your other surgeons or your anesthesia folks that in this situation, as you said, Danielle, this is not, liposomal bupivacaine is not effective?
Yeah, I haven't noticed a struggle
Yeah, I think
with it. Yeah, or
yeah. I think for the most part, people have gotten on board. I think when we were starting enrollment in the study, it was a lot of, education, and getting everybody on board on the forefront of the study, just because we all kind of have the bias that we're giving this medication that works, and that's why we do the studies, is to actually have more objective data that says it works and we should be giving it.
Always good to have an evidence versus evidence-based approach. We say that a lot actually on the podcast. So, and I can see Lisa laughing too. So we've talked about the importance of this study. Danielle, what are the next steps for future research though in this topic?
Yeah, I think looking into the human side of things, especially anesthesia, they have done a lot of studies and seems like have gotten away from using it on the human medicine side, because for the most part, they've seen that there isn't a significant difference as well. I think they are in a similar boat of they're using a lot of multimodal approaches for that. So I think there still may be a subset for, would this be more useful in a general practice type of setting, or where we're not using those local blocks as commonly. Hickson and UGA group, they also recently published a paper on the liposomal bupivacaine, and they used an electronic algometer to actually more objectively measure. So I think that would just be another objective measurement that you could do in a future study in combination with the pain scoring. But I think, again, for our purposes, similar to what we were doing in real life, similar to how most people assess pain, using them to do so. So I think our other avenue for it, not sure how much more our group is gonna do with it, but yeah.
So Vanna AI is definitely something that's super interesting, and we're kind of seeing more of it being published in the veterinary space. Do you see a role for AI in this area of research?
Yeah, I think it is an interesting question. And I think, initially we've talked a lot about it at our institution in terms of, how could it make us be more effective teachers or make things more, efficient, with anything that we do. I think specific to this, my thought would be, I wonder if this eventually could turn into something that helps us with pain scoring, because really a lot of the information that goes into these pain scaling systems, no matter which one you use, whether it's the Glasgow or another one, I mean, it could easily go into an algorithm. So I wonder if, rather than having to have your nurses sit there and figure out the score, would there be some way through electronic medical records and things like that for something to say, hey, maybe you need to think about more analgesia for this patient?
I always love the answers to that question. I think it's really fascinating. So we'll see what happens in the future.
Yeah.
And for those of you just joining us, we're discussing how the use of peri-incisional liposomal bupivacaine was not different than placebo regarding pain score or rescue analgesia in a randomized clinical trial of 83 dogs with our guests, Vanna and Danielle.
Vanna, how did your previous training set you up for success in study design as well as getting this manuscript across the line to publication?
Yeah. So I was fortunate between my internship and my residency. I did a 2-year research fellowship and master's program at Georgia. So, and as part of that, we were actually doing a lot of surgical research. So a lot of pain scoring, a lot of thinking about, making sure we were doing right by those patients. And so I think by and large, I got the most experience with that type of study and with really just scientific writing through that process. And, from there, I think I have a good number of publications. I think every time I go through the review process, I learn how much I don't know and how much I have to learn, but it's okay, lifelong learning and all of that. So
yeah, getting reviewer comments back is always humbling and educational. So similar experience as well, but we're really thankful for them. So now we're going to move on to a set of questions that's really important for our listeners. Danielle, what is one piece of information the veterinarian should know about using peri-incisional liposomal bupivacaine regarding pain score or rescue analgesia?
Yeah. So I think the biggest thing is following label instructions as far as not giving it to, animals who are nursing pregnant, not giving it in an infected site. And as long as they're able to, safely draw up and administer that in a multi-dose fashion, I think we're not really seeing evidence that there's an increased risk of surgical site infections. Our numbers were really small, but our, infection rate was 6%, which is fairly standard. So I think overall it's safe to do. We just don't have a lot of evidence, at least in soft tissue surgery, that it provides a significant difference from not doing it.
And Vanna, on the other side of the relationship, what's one thing clients should know?
Yeah, I think, Danielle alluded a little bit to this earlier, but our study, we are very much kind of in our ivory tower, right? We have anesthesiologists, we have 24/7 nearly full staffing. And so, while we didn't necessarily find a benefit in this situation, we do have studies like the Wheeler JAVMA 2023 article that maybe suggests in a situation where you don't have quite as much access to the full pharmacy and the anesthesiologist, maybe it is more helpful. So, if you have a practitioner that's using it, I wouldn't just assume that they haven't read the literature and just don't know that it doesn't work, because it may work in their situation. And, as Danielle just mentioned, I think it does seem to at least be safe. So I think, as always, talk to your vet about analgesic options and what's best for your pet.
Outstanding answers and really helpful to the clinicians. As we wind down, we like to ask a little bit of a personal question. So Danielle, we'll start with you. And Sarah and I have a hypothesis. We're doing a prospective study on the answers to this question. When you complete a puzzle, do you begin with the interior, middle, and maybe go by color or a shape? Or do you start with the exterior border pieces or maybe a hybrid?
Yeah. Do we get to find out your hypothesis once I
Sure.
answer? I start with the corners and then the borders and then fill in from there.
Oh, Okay, that's a new one. So we aren't that granular in our responses. We predict surgeons do exterior and medicine folks do interior. And if you're a soft tissue surgeon, you get more medicine, right? You get more medicine along. So sometimes you're a little more hybrid. So orthopedic surgeons are 100% border.
Yeah, I mean, I did tell her there's only one right answer to this.
Yeah. Maybe I've missed my calling because I seem to have some orthopedic tendencies.
Vanna, is yours interior then?
Oh, absolutely not. It's only exterior.
All right, you blew our hypothesis. Well, we're not done yet. You know, there's a standard deviation. Vanna, for you, what's your favorite animal fact?
Yeah, so I did Google this because otherwise my answer would just be like anything about cats because I'm a crazy cat lady. And in that, I learned that Komodo dragons can actually have like essentially virgin births. Apparently, they can fertilize their eggs and they'll be like identical twins, essentially all identical young, but it is possible for them to make babies without the boys. So thought that was pretty fascinating.
That's our first Komodo dragon fact, actually. So we've actually got a lot of octopus facts recently. And I thought you were going to say that based on our conversation before the podcast about the book you're reading. So.
You know, octopi are pretty cool too with the 3 hearts, but
yeah, literally someone said that yesterday on the podcast, actually, as part of their response. So yeah, no, they're pretty awesome. Thank you both, Vanna and Danielle. We really appreciate you being here today and also for sharing your research too with JAVMA.
Yeah, thanks for having us.
Yeah, thank you.
To our listeners, you can read Vanna and Danielle's article in JAVMA. I'm Sarah Wright with Lisa Fortier. Be on the lookout for next week's episode, and don't forget to leave us a rating and review on Apple Podcasts or whatever platform you listen to.